So here's your exams. Did you pass out the exams? Starts at 12. You get 2 hours. 1400. That's when it ends. Remember, NID, name.
Something's wrong with me.
What's wrong?
I don't know. Breathe. Take a deep breath. Man, my chest hurts.
Ask
Your
yourself.
chest hurts?
My chest hurts. I don't know what's going on. I feel like I'm dying.
Something's
Yes?
wrong with Daniel.
What do you mean?
Well, something is wrong.
Is everything okay?
Yeah, back up.
Back up.
I need air.
You need air?
Something's going on. Open the door.
Like what? What do you mean? Do you need water or something?
I gotta get out of here. I gotta go.
Where are you
I gotta get out of
going?
here.
Someone call the nurse. Hey, you okay?
Fine.
Fine. Well, you just kind of like left the test, so
My chest hurts.
chest hurts.
Yes. Just go away.
I can't go away. I can't leave you alone. You just left my class like that. You want to take some deep breaths with me?
Can't.
You can't? Come on, just inhale.
I'm in here.
Slowly. In through your nose, out through your mouth. That's good. That's better. So I understand you don't want to go to the hospital, but I'm really worried about you. Would you like to go to the nurse? At least just to check you out, make sure everything's okay.
No.
No? Come on, keep breathing with me. Slowly. Inhale. Exhale.
I'm trying.
I understand. But I really think it would be best if someone saw you right now.
Okay, fine.
All right, let's go. Whenever you're ready, though.
Let's go.
Come on, I can't leave you alone.
Hi Daniel, my name is Isabel. I'm going to be your nurse today. So I heard you were having some shortness of breath, your chest was hurting. Can you tell me a little bit about what was going on?
I mean, that's basically it. I was taking an exam and I felt prepared for my exam, but I don't know what happened. Something hit me. I started breathing really fast. My chest just felt like it was on fire. It just hurt so bad.
Okay.
I felt like the walls were closing in. I had to leave.
Okay. Can you tell me about what you were kind of thinking about when that was going on?
Honestly, I was really scared. I thought I was gonna die. I didn't know what was going on.
Okay. Well, we're here to help you, and we're going to find out what we can do for you, okay? Do you have any history of this happening? Has this happened to you before?
No, I mean I have. I've been anxious before in front of people,
Okay.
and something like that. You know, just a little bit of anxiety here and there.
Nervousness?
Nothing. Yeah, a little I've been nervous. Like, who hasn't?
Yeah, that's normal.
I don't know what this was though. Something took over me. I don't know what happened.
Okay. Do you have any family history of this happening or any other mental illness?
No, I mean I have ADHD, but I don't see
Okay.
how that would be related. I take Adderall.
Adderall? Okay. Sometimes medications can contribute to this happening, especially they can contribute sort of like anxiety symptoms. So we'll definitely keep that into consideration when we're kind of going through this, okay? Okay, so we already talked about sort of your medical history. So could you tell me about any past surgeries that you've had?
I've never had surgery.
Okay. Could you tell me a little about how you're feeling right now?
I definitely feel better than I did before. I'm calm now, and I can breathe. My chest pain is going away.
That's good.
I'm embarrassed.
That's okay.
I ran out of the classroom during an exam.
But I think it's important to know that this is very prevalent. You're not the only one going through this. And you need to know that you're not alone in this, okay? We're here to help you, all right? So because you did say that you had chest pain, we are going to have to do a full cardiac workup just because we want to make sure that's not the cause of the problem, all right? So we'll do an EKG. We're going to get to the bottom of everything.
Okay.
Do you need to use the restroom right now? Because we will have to do a urine sample.
Yeah, I could go.
Okay. And this is a kind of a personal question, so you don't have to answer if you don't feel comfortable, but have you ever felt like hurting yourself?
No.
Others?
No.
Okay. Do you feel safe at home?
Yes.
Okay, good. Do you use any substances other than the Adderall?
I mean, I take pre-workout.
Okay. Okay, so how many times would you say that you take that a day?
A day, just like once a day, but
Okay.
like 3-4 times a week.
Okay. Do you take any other caffeine? How many cups of coffee do you have a day?
2 or 3. You know, college students.
Okay. Sometimes caffeine can also make you feel that way, just like the Adderall. All right. So we can talk about maybe reducing your caffeine intake. Okay. Tell me about anything stressful happening in your life right now.
I mean, I was taking an exam,
Yeah, that's
finals.
understandable.
I have a lot of finals going on, and I really want to do well.
Of course, yeah.
It's just, I mean, it's stressful, but
Yeah.
I do pretty well.
And nursing school is very stressful. I went through it, so I totally understand that feeling. But anything else happening outside of school that you think could be stressful?
Nothing comes to mind, but I mean, everybody's got stressors they run into every day, right?
Yep, that's totally normal. So I'll tell you what, I'm going to talk to the doctor. We're going to get him in here to talk to you a little bit. I'm going to talk to the other nurses and see what we can do for you, okay? But again, you're not alone. We're going to do everything that we can, okay? Okay.
Hello, Mr. Mim?
Yeah.
Hi, I'm the doctor, like, overlooking your entire case. So I saw that we ran some tests. Your EKG came back normal. All your enzymes, all your blood was fine. Everything's great. I did see that you had your tox screen come back. It had amphetamines in it. But I'm looking here in my notes that the nurse said that you take Adderall. Is that right? Yeah. Great. How long have you been taking that?
6 months.
Okay. And your PCP prescribed that to you, or?
Right, yeah.
Okay, great. And I saw that, like, your oxygen's good. How are you feeling now?
I'm feeling better.
I'm feeling better. Calm down. Okay, so overall, what I feel like you're presenting with is a panic attack. Have you ever had one before, or
No.
no history? Okay, was something happening before that triggered it? Like, what was going on?
I was taking an exam.
Okay, and that's stressful for you?
Yeah, as a final.
Okay. So yeah, I feel like that's definitely probably what happened. So I'm gonna go talk to your nurse, and we're gonna talk about what maybe we need to do for you to prevent that from happening again. Does that sound good?
Yeah. What if one happens right now?
What if one happens right now?
I
Well,
felt like I was gonna die.
you felt like you were gonna die. Well, there's some breathing techniques. Did anyone go over that with you yet? No. Well, I want you to try to really focus, calm yourself down, and I want you to take some deep breaths if you can. If you can't, if you find yourself really breathing hard, I want you to cup your hands. That way, it'll hopefully slow your breathing down. You're not going to blow off all your CO2 and you won't get that funny feeling.
I could do that.
Okay? Do you have any questions or concerns for me?
No, ma'am.
All right, let me go talk to your nurse, okay? All right, so I just went in and seen Mr. Mim in room 102. He's a 28-year-old male, and he is presenting with signs of a panic attack. So what I'm going to do is I'm going to start him on Zoloft and Xanax. I'm going to need you to go on and do some education with him about anxiety and panic attacks. And I'm going to need therapy. So what do you think would be the best?
Correct. I believe cognitive behavioral therapy is something that we can work with Mr. Mim. And medication adherence would also be something beneficial to his health. So with the use of Zoloft and Xanax as his medications, I believe those should aid him in preventing such panic attacks that he had while he was taking his exam. But other than that, I believe with the education that we'll provide, Mr. Mim will be in good hands.
Okay, any more questions about him?
No, I think we're on the same page.
All right,
Perfect.
great.
All right, Daniel. So I just talked to your doctor, and she seems to think that you had a panic attack. Is that correct?
That's what she told me. Yeah.
All right. So I really want to talk to you about some things that can prevent this from happening again, all right? Because it's really important that we address this. So one of the things I think can really help is just some breathing techniques. So what we're gonna do, I want you to join with me. So So what we're gonna do is just take a few deep breaths, okay? So do you wanna do that right now?
Sure, if you think it'll help.
Okay. Okay, so breathe with me, okay? Ready? One more. Okay, how did that feel? Good? Okay. So you can use that at any time in the day. When you feel anxious, you just have to excuse yourself and just take a few deep breaths, all right? I think that would really help you. Also, we could talk about some situations that might provoke your anxiety and what to do when those situations come up. So you said tests are a really big stressor for you, right? Okay. So maybe you could do the deep breathing before you go take a test, or even while you're taking a test. You could just stop, take a few deep breaths, go back to the test refreshed with your mind clear, okay? Sure. Also, I want to encourage you to talk to people around you, okay? So whether you have friends that you really trust, family, you could reach out to, I can connect you with a counselor. We definitely have resources for that. And just talk about how you're feeling, because the more that you internalize that, the worse it's going to feel, all right? So I really encourage you to talk to someone, and we can connect you with a counselor.
Okay, I understand.
And also just really knowing your triggers. So you said the exam, know that that's a trigger for you, so that not that you can anticipate the anxiety, but that you know, okay, this is triggering for me, I have to prepare myself, all right? Also, some things that could really help, I think, are exercise. A lot of patients I've seen with anxiety really think that running is helpful, go to the gym. Do you like working out?
I do, I go to the gym.
Okay, I think that could really help, just blow off some of that anxiety and stress.
I do Pilates.
That's good. That's really good. What do you think? What else do you think could really help you in this situation?
I don't know, I just don't want it to happen again.
Yeah.
I'm just nervous about it happening again.
It's really scary. Maybe I can talk to your physician about getting you on some medication that can help. And I really think that these techniques can really prevent this from happening again, okay?
Okay.
Do you have any other questions or concerns for me?
No, I don't think so.
Okay.
Okay.
Well, just know this is common. You're not the only one with this. And it's totally manageable and it's treatable, okay? All right.
Hi, Mr. Mim. I see you were doing some discharge paperwork for you.
Ready to go.
Okay, great. So, Isabel, you went over some techniques and stuff in case he does start to have a panic attack, right?
Yeah, and I think we did some of them together, and I think they could really help him.
Okay, so you feel comfortable
Yes,
with
ma'am.
that? Okay, great. I'm gonna start you on an SSRI, Zoloft, to help the anxiety. And I'm also going to give you a prescription for Xanax. That's kind of short acting. It's gonna help when you feel like you're going to have a panic attack. The Zoloft will keep you down. The Xanax will help when you feel like a panic attack is coming on. Do you understand that? Great. I'll fill those out. They'll be ready to pick up at your pharmacy. Do you have any more questions or concerns before you go home?
No, I'm ready to go.
No, you have a ride and everything?
Yeah, I have someone to come pick me up.
Great. Okay. Well, it was very nice meeting you, and I wish the best for you. Okay.